And I think it's really interesting. When I studied nutrition at Johns Hopkins, often people say, but you're a dermatologist, why do you need to know nutrition? And so it's really interesting because, if anyone suffers from acne, it's the simplest thing, but it can be quite life-changing. It can affect your mental health quite significantly. So, often the ones that, the little blurb I wrote in my chapter was that, there are thousands of diseases in dermatology, often with very low incidence. But the most common conditions that have the highest amount of incidence or prevalence in the society often have some kind of nutritional link to it. And with the improvement in understanding the gut microbiome and the skin microbiome, I think that is going to increase. That information that we know now is very small, but I think as it expands, we'll get a better understanding of how the gut plays a role with the skin. And we're already seeing that in few conditions like rosacea and psoriasis. So I always say to patients, like, it's really important because it impacts your life in more than one way. When you have something on your skin, it's not just skin deep. It is beyond that because it affects you mentally quite for a long period of time. Whereas if you have something internally, often you can't see it. So it's often hard to unless you see a CT scan or something else where physically you can see that disease, it doesn't leave that much. It can be very impactful, but when it's on your skin, even if it's a minor disease, it has a bigger impact, I guess, on a person. So any little changes that you make on your diet can have small or big impact depending on how much you put in.